Cool. How are you, man? Doing all right?
Good. Living the dream. Working hard.
Yeah, I bet. Thank you for doing this. I know you're having a already pretty busy guy, and this time has been super busy. But given that you are in the middle of everything, and we are shielded, we're home all the time. Uh, Everyone I talk to has so many questions. So I was like, instead of bugging you with questions where I only get the answers. I was like, let's get on an interview or like a FaceTime and
Sure.
just ask you directly. Let everyone else know some of the things that I mean. There's so many news out there. People say do this, don't do that. Um, so I wanted to hear from you. But maybe in the beginning, you can. I mean, you're my brother. I know you well, but maybe you can tell us a little bit about what you do, where you're located, what you've been days like lately, so that people who don't know who Dr. Beshara Helou is get to know you a
Okay.
little bit.
Okay. Thanks, G. Dr. Hello. We're the two
Oh
doctors
man,
in the family. I'm the
yep.
medical guy, you're the PhD guy. But I'm an internist. I'm in the lovely state of Delaware. I'm in Georgetown, Delaware. I've been here since 1997, 23 years. I graduated from GW, internal medicine. And most of my patients are older, complicated, sick patients being diabetes, high blood pressure, cholesterol, heart disease, heart failure. And we do some primary care too on the side. I have two nurse practitioners that work with me. We got a huge practice, around 5,000 patients in our
Wow.
area for Delaware. That's pretty big. And we still go to work every day. So
So
unlike
how
my
was
wife,
it? Yeah, go ahead.
unlike my wife whose gym shut down, my kids are home from school. I still get up in the morning, pack, and just go to work. Thankful that I got a job, but nervous that you never know what the next patient is going to bring to your office and to the staff and what kind of outcome you may have from contracting this new virus in town.
So you're going to the office. You still have patients coming in and seeing you. Why are patients coming in? Why? How come this did not stop?
So, well, if we close down, we're primary care doctors. That's the first thing that would impact the hospitals in a bad way because anybody who has a simple problem or a complicated problem, if the primary care doctor's office is closed, they're going to have to resort to walk-in clinics or emergency rooms. And we're trying to keep people out of the hospital because that's where you have the highest risk of catching an infection. And you don't want to overwhelm them with things that we can do ourselves. So, what we did a two-part resolution system is one, anybody that's coming for routine follow-up that still feel comfortable coming in, we let them come in, we space them apart, and we put them straight into one of the exam rooms so we can keep the waiting room as little dense as possible to avoid close contact. And we do a screening measure for patients calling in if they're sick. We try to see how sick they are, what kind of symptoms they have. And I have a checklist for my staff to go through. Do you have a fever? Do you have a cough? Do you feel short of breath? Have you traveled to a high risk area? Luckily, we live in Sussex County, which is 2 hours away from the closest airport. We're not in the summer season where we have a lot of people from New York, New Jersey coming. So we're considered a low risk. So if I get a farmer or a local person, a teacher that has not gone to school, has not done anything, has a cold, we ask them to come in, put on a mask and gloves immediately in the waiting room. They notify us immediately, and we've dedicated 2 out of our 10 exam rooms for sick people so that we put them straight in, and we have a dedicated stethoscope, cleaning solutions, everything is in there. So when I walk into those rooms, I have a mask and I have gloves and I have a dedicated stethoscope, take a history, see what it is, and based on that, come up with a plan. So we have a two-part system, actually a three-part. The sick people try to get them in and out as quickly as possible, come up with a game plan. The regular
Hmm.
follow-ups, these are the ones that business as usual, which is around down to 60 to 70% of our original load because we
Okay.
have a lot of people that are uncomfortable coming in. And the rest is FaceTime. We have a telehealth system now. Well, we did
Okay.
FaceTime, we did the messenger through Facebook, and now we have a telehealth system that's up and running. So we can do something like I'm doing with you. If it's something we
Right.
can manage over the, face to face via the technology, whether managing your blood sugar, your blood pressure, you have concerns about a cold or contacts. The biggest thing I have people like, someone in their job had a contact. What do I do? Where do I go from
Hmm.
here? So we
That's
try to resolve it
exactly
that way.
actually one of the questions that I had was in situations like if someone, get to know that there was in contact with someone who's tested positive, what is the right thing to do?
That's the biggest problem, Jerry. 80% of people have absolutely no symptoms to minimal symptoms that can be brushed off. And these are the ones that could transmit it to other people without them knowing. And that's how the wildfire could spread very quickly. And the biggest mistake we've done in this country is we've been late in the game. January and February, we've only tested 325 people. Till March 15th, we've only tested 14,000 people. In the last 10 11 days, we're ramping up around 40,000 tests a day. So the pool of people that may have the disease walking around is enormous. Unlike some other parts, like South Korea, which is 30 million people, they were doing day one 10,000 tests a day.
Yeah.
So that's the biggest fear now is that you don't know who has it, who doesn't. You got to assume that anyone that has mild upper respiratory symptoms to more severe may have it, and hope for the best and try to do the universal measures to distance yourself. This is a respiratory infection, so it's spread by coughing, sneezing, droplets in the air. The problem is you'll see people in general, they're touching their face and they're touching other counters, doorknobs,
Yeah.
magazines. We've eliminated. So the possibilities of you contracting it is enormous. You don't have to come in physical contact with that person. If that person coughed or sneezed on a coffee table that has 5 magazines and you grabbed one magazine, you opened some pages and then you decided like, I gotta rub my eye or just, I gotta scratch my nose or what have you. And then you inhale it and it makes its way into your system.
How
So
long does
of
it
course,
live on a surface like that? Like, let's say, like, let's say I go to the grocery store, right? I am going to the grocery store. I have to get food once a week. Like, okay, how do I know that there is someone? I mean, I wouldn't know, but how long would that virus live on a surface before it's gone?
in general, coronaviruses are not very hardy viruses. They don't last long. Viruses are not animate, but I got my balancing. Oh, sorry. The wife interrupting.
It's okay. I'm
So,
working
but
from home these days. I know
okay.
exactly how this is.
But it's typically hours, but unfortunately, it can last up to several days, depending on the surface conditions. If they're metal, if they're porous, then they're less likely. But if they have any moisture on them, then they're more likely to last a bit longer. But it's typically a matter of hours.
Okay.
There has been reports up to 2 days, 3 days on surfaces that they've swabbed, which kind of makes it a little more disheartening. But in general, coronaviruses are several hours on surfaces.
Yeah, like I read somewhere that in one of the cruises, they were confirmed that they tested after 17 days and they were able to find it on surfaces, which was very scary because they didn't know that it was going to live that long.
That's a possibility, especially if you have a large viral load. Like if you have a big load to start with, so you have more of these little messenger RNA, the viruses floating around, then you're likely to see some at a longer period of time versus if someone just touched the surface area and someone came behind and wiped it with. And that's what we say, like universal hygiene is the best way to avoid this.
Yeah.
You gotta wash your hands as often as you can. You can't imagine how many germs you have. Avoid touching your face as much as you can. And whatever you come in contact with, that's where it's difficult. You got to make sure when you bring it home, that you wash it, clean it, try to sterilize it as much as possible before you put it on your countertop in your kitchen.
Okay. So, okay. In cases where, I mean, you hear in the beginning that it's just a form of flu, right? Like how bad this could be. But we see it spreading like crazy. But let's say in cases where someone gets it, um, what could be the worst that can happen? I mean, it starts with these symptoms, but then uh, where we haven't heard enough about like, okay, people die, but like, what is that process? Is it like deadly instantly? Is it something where over time you're just getting as if you have the flu? What would that process be like?
All right, let's talk about the flu first, because we know a lot about the flu. Flu is seasonal. It hits a lot of people. Between 9 and 40 million Americans get affected with the flu every year. The mortality rate is 1 case per 1,000. This one is a new virus. We don't know if it's seasonal or not. Typically, a lot of viruses die off with hotter, warmer weather, but this one has been increasing in areas that are already warm. United Arab Emirates, Saudi Arabia, Singapore, Brazil, Florida, New Orleans. So that is scary a little. It might not grow at the pace that you'll see in colder weather, but you might see it. The mortality rate of this virus is way higher than the flu. In Italy, it's 10%. In Spain, it's around 7%. In China, it's around 2%. In this country, on average, it's a little over 1, between 1.2 to 1.3%. So if you compare it to the flu, if you get the same number of people that get the flu will get this virus, you're in trouble. That's one part. The other part, this virus has a favoritism towards your respiratory system. It loves the upper airways and settles in your lungs. And what we've noticed, there's high risk, low risk people. High risk, age over 65. If you have a comorbid illness, that is, if you're a diabetic, you have an autoimmune disease, lupus, rheumatoid, you have heart disease, you smoker, you have chronic kidney disease, any of these ailments put you at high risk. Of course, if you have any form of lung disease, asthma, COPD, you're more likely to have a serious complication and die from it. And during this process, even if you don't die from it, you need a lot of medical support. And that means you need to be in the ICU. You can be physically in the ICU without a ventilator, or you may require ventilator support. And the data looks kind of scary that some people are required for up to 2 weeks, 3 weeks. So even though you may have 10 patients and you're growing at a rate of 1 patient per day, but you need ventilators equivalent to 30 patients, because you might need 30 ventilators for those people until they get better and get off the ventilator. So the biggest problem is respiratory failure. Like, they have what we call an ARDS, adult respiratory distress syndrome. And the rates of this disease vary by age. 65 and older, on average, 20% of them will either be sick, critically sick, or die. And the young ones, and that's where they became a little ignorant. Like my kids, teenagers, said, if I'm not going to die from it, it's like a cold, so be it.
Exactly.
Yeah. I'll get it over. Yeah. And the rate of serious complications, critically being ill or dying, is less than 6%. And of course, the rate of death is around 1 per 1,000. So it's much less. And then you have the young ones. The under age of 5 is around 11%. So we see them more vulnerable in that age group, not as much as the older ones. But what I told my kids, imagine you have it, you go hug your grandmother or your grandfather, and they get it, they end up in the hospital or dead. You're responsible for that. So that put a sense of responsibility that we are all vectors that could transmit this and expand it like a wildfire. Yeah. So that's the biggest problem with this virus, that it will tax the healthcare system. It's going to cost a lot of money and a lot of effort in the hospitals, and a lot of hospitals might not be able to accommodate them. That's the problem they have in Italy. They have to make a choice. We have one ventilator, I have an 85-year-old or a 50-year-old. Who am I going to try to save? So they're letting the 85-year-old go home, die at peace, or die on the ward without a ventilator while they're trying to save the young one.
That's wild. Something related to the flu, like I heard somewhere, like it's advised to take the flu shot now. Like, does it make any sense or any impact on this?
Well, they always say better late than never. So the flu season, because of global warming, whether you believe in it or not, every year is coming later and later. Typically, it starts in October, ends in end of February, beginning of March. But every year, we're seeing it extend towards the end of April. So it takes 2 weeks for the flu shot to give you immunity. So we're March 26th. We still have 5-6 more weeks of the flu season. So if you take it, you will have some additional protection. And you got to remember, whenever you have a viral infection, especially the flu, it's like your immune system is taking a hit. If you get the flu, it's taking a huge hit. When your immune system is down, you're more prone to have something else, whether it's the coronavirus or any other infection. And that's why flu patients can die of complications. So if we have this coronavirus, we tell people time and time again, they're all running, they're wanting a vaccine for this one, yet They say all sort of stories about the common flu vaccine that the government trying to go after us. It doesn't work. That's one way
Right.
pharmaceuticals trying to make money. But yes, better late than never. The best time to get a flu shot is October, November, because the immunity to the flu shot lasts 4 to 5 months.
Okay.
So you want to cover it during the peak. Never get it too early. I have a lot of pharmacies give it in July and August, and I call and scream at them,
Right.
too early. Then you
Right.
gotta consider another shot.
That makes sense. What about, again, I'm hearing these things, but people are saying like, okay, test kits are very rare, and the production, like Ford right now, is turning some of their factories to be assembly lines to create ventilators and test kits, working with 3M and GE. But some people were saying in the news that uh, maybe X-rays on the chest might be another way to test if you have the virus or not. What do you think about that?
Let's pray to God that's not the way you want to diagnose yourself. There's a more unique pattern on a chest x-ray for the pneumonias they have. For whatever reason, targets the bottom of the lungs and the periphery.
Right.
And you'll see what they call a nodular appearance. You see like little nodules and some interstitial changes. These are not, 100% pathognomonic of the disease, but they could be suggestive of it. But when you have that, that means you're among the sick ones, or the very sick ones, or in the hospital. That's not how you want to diagnose those. And a chest X-ray is $40. A test kit is around $51. That's what most insurances, laboratories are charging for. Like LabCorp charges $51 and change, AccuReference. The
Right.
problem is the availability of test kits and the turnaround time. That's the biggest mistake
The
that I believe
results
has
of
been done.
someone getting a result of whether they
In
are,
time.
yeah.
I give an
Why does
example.
it
We
take
had a
so long?
patient.
What is it? Does it have to go? I mean, the test is a swab, right? It goes deep, swab something, and then it has to go to a lab.
There's two ways. You can do a deep nasal swab or pharyngeal swab. And you got to go high up and really get a good specimen, rotate the Q-tip and put it out and send it. The problem is each lab has its own reagent. The best tests are the PCR, like, polymerase chain ribosome action. That's what we have. I have it in my office for the flu, A and B, PCR. Like this way you'll detect it. Because some may look at an antigen part or surface molecule of it, and they'll have more false positive or false negative. PCR testing is the most accurate. But each lab has its own testing. And the problem is like one of the other big problems is we were late into forming those kits. And the first batch that CDC formed were not good. They were not effective, and
Wow.
that delayed things further. So you cannot contain an animal if you don't know who has it, who doesn't. And that's why Korea did a great job. 10,000 kits per day. That's equivalent to us pumping 130 to 140,000 kits. If you look at their volume, 28 to 30 million people versus 350 million people. 10,000 tests, we should 120. You do this in the beginning, and let's say you and I just not feeling bad or just a little sniffles, then you turn out to have a positive, quarantine 14 days out of here, gone, so that you prevent the spread. I'll give you one alarming statistic. These are asymptomatic, not symptomatic. The more symptomatic you have, the more viral load they have. Theoretically, the more likely you're going to spread it to somebody else. If you are asymptomatic in 3 days, you give it to 2.5 people on average. If you are asymptomatic and gone undetected in 30 days, you give it to 409 people. So imagine the exponential growth. And that's what they keep pointing about, flattening the curve. Like you're going to see a spike of a lot of people undetected going to their loved ones, going to the communities, churches,
Right.
bars, restaurants, and spreading it. And all of a sudden you have an exponential growth of it, which we're looking at in New York in the next couple of weeks. And then some other parts of the country, like California, a little bit later. New Orleans is a huge situation. They believe it's related to Mardi Gras.
Mm.
So that's the bad part. Like I always tell people, it's like rush hour. If everybody gets out of work at 5 o'clock, the roads are jammed. It's
Yeah.
disaster. If we can get the traffic flowing over a 24-hour period of time, everybody will make it home at a good time. The same thing with
Right.
illness. You don't want everybody get sick all at the same time.
Very, very, very interesting, especially around this brings us to the social distancing thing, right? So obviously in the beginning, I feel even till now, people are not taking this as serious. It's more about, oh, okay, social distancing, but then you still see like people hanging out together, one or two people coming over each other's place, or they're going out and going out to the bars. Or I've seen in Florida last week, spring breakers on the beach, just like partying. Like, what do you think as a doctor? I mean, you said some great things about like that you can be carrying this and this actually can impact you. But like, what would it be to get people to understand that this is this if we don't do this, this can be catastrophic and it can like there's something bad can happen out of this. Like how worse, what would be the worst thing that comes to your mind? Worst scenario that could happen if we don't take this seriously and contain it?
If people go out and resume their life as they want to, you can have 90 up to 100 million Americans get infected. And I'm going to say at a rate of 1%, not more, dying. That's a million people dead. And you live with that. Forget the economical burden on hospitals, ICUs, ventilators during that period dealing with the other sick people. So lots of dead people, lots of sick people. And the sad part is, and that's why, like, my wife thought that was a pessimist. You know, I told you I grew up in Lebanon. We grew up in war. I told her
Hmm.
this is a different of type of war because you don't see the enemy. It's invisible. And people don't fear it. If you tell them there's a fire, they see the flames coming, they know it's coming. Like in California, everybody sees it. Everybody knows what to do. You got to run. This is an invisible enemy. And the
Yeah.
longer you let it spread, the more it's going to be devastating, and the measures to control it are going to have to be more and more drastic. If we did this in January, we did the mass testing, quarantine people that are infected, we would be like South Korea now. We'd be better than China because China were hit first. They didn't know what hit them. And the
Yeah.
drastic measures that the Chinese did, I don't see it happening in this country because people take their freedoms a little bit too far out. And part of your freedom is being responsible, that you have to be a member of society to do your part and distance yourself. When I come home, I don't hug my wife, I don't hug my kids. I have a set of clothes for work, set of clothes for coming home. I come in, take a shower, change my clothes, then I sit with them. And if I don't have to come close to them, I try not to because I'm high risk. And
Yeah.
I told my kids they wanted to go see the sunset with their friends. I'm like, all right, so you go each one in a separate car. You sit in your cars next to each other and you turn your phones on and talk to each other.
Yeah. Yeah. That's wild. Um, so this is the worst scenario. What is the best case scenario? Like some people are, some people are postponing, weddings and everything getting postponed. But like, in how long do you think we're gonna be in this for?
Best case scenario, 2 to 3 months.
So into
That's
the
best case
summertime.
scenario. Yes.
Okay.
Like if coronaviruses, the name corona comes from Latin, like my big fat Greek wedding.
Really?
Coronavirus is from crown or halo. Like it's a crown virus. The typical ones, like there's a human corona, there's the animal coronaviruses, and they typically come from animals.
Yep.
And it's funny, I had like 5 cases of coronaviruses diagnosed in the last 2 weeks because we do the complete vital panel, but none of them are the COVID-19. That's a new brand, as I call it. There's
Okay.
the HKU1. My favorite one is the OC43 because to me it's like a sushi roll. The HKU1 came from mice in 2005. It came from China too. So
Yeah.
a lot of these have come from that part of the world. But most of them actually they die with the common cold and they present like a common cold. This one has affinity to the lungs and is causing some serious damage to the lungs, serious complications, and people are dying from it. The problem is if it's cyclical, this is going to be a problem. It might wane in the summer, come back next season. We're not going to see a vaccine in 12 to 18 months in the best case scenario. And I don't know what the effectiveness of it, because if you look at the flu shot, we don't know the effectiveness
Right.
of the flu shot every season. It varies, and that's something we've tried time and time again. The one good thing with this virus so far, it has not mutated yet, because that would be dangerous. A lot of people ask me, is there more than one type? Because some people said people are not as sick in some parts, I'm like, no, when you say COVID-19, you're checking for this RNA sequence in this particular virus. There are other coronaviruses that are much nicer, much milder. They're like a common cold. 5-6 days, you're over it and you go on with your life. But with this one, best case scenario, like there's no way on earth that anybody's going to go to church on Easter unless they really want to, infect more people and go back to square one and try
Yeah.
to reenact supreme measures. So I'm hoping that doesn't happen, but I cannot see anyone having any plans for the next 2 months of any big social event. That's
Yeah.
best case scenario.
Wow. Yeah. Interesting thing about the South Korea story. There's, and I'm going to send you this article, but they tracked patient 31, who, as the cases were increasing, each person who had the disease, passed it on to 2 to 3 people. Patient 31 passed it to 1,100 people, and they show you where he went, or she, I don't know exactly, but they went to church, they went to the market, they went to the grocery store, and they went on a trip with a bunch of people, and then within just a short period of time, all these people, and it's just like, it's insane how it can spread. I just feel, I don't know what it is. It's just people, okay, they're staying at their home and stuff, but people are still not considering that this will impact them. Maybe because when it started initially just saying that it's only old people are getting the most impacted. But I feel sometimes, and I was talking to my colleague earlier today, I was like, you know what? Maybe they need to show what's going on in hospitals. Maybe they need to show the chaos, just so that people understand how drastic this is and how this can impact everyone. But then you fear, well, is this going to cause more fear, more chaos at home? I don't know. What's your thoughts about that?
Oh, there's always a balance between being paranoid and sounding the horn too early, and being too downplaying, too safe, and pretending that everything is okay. So, historically, like when you look at some of the weather forecasts, whatnot, we tend to be drama queens in this country. So people already, like when they sound an alarm for a tornado, people don't run for shelter. So there's this desensitization because hyped up. Everybody likes, if there's an average news, no one's going to run for it. But it's a breaking news or
Yeah.
a flash alert or whatnot, then people run for it. So there's a desensitization in that part. And another part that really bothers me a lot is how it was downplayed, that this is a problem from China. It's not a problem here. We only had 15 cases and they're getting better and whatnot.
Yeah.
And during that period, no one was doing their job. Like there is what they call a pandemic team that you should always have. I always tell people, when you are talking about security, the military has billions of dollars. You need that. We need cybersecurity because if someone gets into, I always say the traffic light system turns them all green in this country. Tens of thousands of people will be killed and seriously hurt. The same thing with fire extinguishers. Like in my office building, we have them everywhere. We've been there 13 years. We've never needed them. What does that mean? Should we get rid of them? No. They got rid of the pandemic monitoring team in the White House. They played it lightly. We thought that we don't need testing kits. The WHO offered us testing kits. We wanted to make our own. Until we make our own, we should have a surveillance system to monitor the size of this tsunami so we can be prepared. And timing is everything. That's where, like, this is March 26th, and we're still not up to par with testing. How could you contain it, and how could you spread the fear in people if they don't know the volume of patients that are infected and the consequences? See, China, the problem with it, they don't give you everything. And I got some anecdotal reports from some people that have family there that you live in a development, they'll put a gate at the door, and wherever you're going, if it's not critical, essentially you go back home. They've welded the doors to big buildings, and this way nobody's out. Whatever you need, we'll get it for you. Unless you have a medical emergency, you're staying there. That's the difference between a communist system and a too much freedom. That's why I always tell people freedom is for those who are responsible. You have to exercise your freedom responsibly so we don't have to get to these radical measures. And we're not even there in full radical measures.
Yeah. I was just reading the news. Like you can see it. That's a wave coming, right? Like from China to Italy, now Spain, and we're just getting. I mean, the cases in the U.S. now surpassed China. I just read that
We're
looking
number
at John
one.
Hopkins. We're number one. Yay.
We're
But
winning.
I we're always on top. But I feel like this is we're still the biggest part of the wave is still coming, and that's the part that is worrying me and a lot of us.
Listen, I'm a healthcare professional and I'm in the medical field, and I sometimes question it. And my wife comes and she always says, "You sure you're not just overreacting and this?" And you start doubting yourself. But
Yeah,
you look at the science, and I'm not looking at it just here. I look at Europe. I look at Germany, who predicted that 40 up to 60% of the population
yeah,
will get infected. So when you see these kind of alarming numbers, you can't help but say we need to be prepared. And I'll give you the bad part of it. Till now, I have not received any proper masks. I only have surgical masks because I stock up on them, which
hmm,
are not efficient or effective with this virus. You need N95 masks, you need full face shields. I don't have any gowns. And test kits, I got zero from the state, zero from the government. I got five from LabCorp, and we contract with a lab that gets them from Germany and Roche. And we had like 22 kits left. And we are being very selective. It's almost like you're giving someone a diamond. It's a
yeah,
freaking, like you should be doing massive testing on anyone that's at risk, or I should be checking myself on a weekly basis.
yeah,
We had a little incident with a patient. She was convinced she had it. We did the full vital panel. She tested positive for rhinovirus. She was not happy. She went to the first hospital. They swabbed her, didn't think she was risk enough, so they didn't send it. She went to another hospital, and those hospitals, they sent to LabCorp Saturday a week ago. We did not get the result till yesterday, 10 days. So my nurse practitioner, we had her tested, and we got her in 3 days. And luckily, my nurse practitioner was negative. Then the patient came back negative. But imagine if that person was positive and it's 10 days, what kind of
yeah.
damage you would have caused. So you need the 45-minute turnaround time, or at least reasonable 48 hours. Go home after you get tested. You're not going to leave. You're
Don't
going to be
leave. Yeah,
quarantined till you get the results. So there's a huge moral obligation. Everybody's got to think about their loved ones. If it's not about you, you're 19, 20 years old, you're invincible.
yeah,
I've been there. It's about your grandparents, it's about your parents if they're sick, it's about your nieces and nephews if they're
yeah,
young and 2 or 3 years old. These are the people you got to think about.
yeah, yeah. Well, Doc, thank you so much. This was very, very helpful. I thank you for sharing all that knowledge. And
Anytime, dude.
we
We can
might
talk
we
for
might have
hours
to do
about
this
this.
again. I know we might have to do this again because it's nice to hear it from someone like a trust source, and in it we're hanging at home. You're like right there, on the front line. So
Yeah, I
thank
still
you,
get up, go
and
to
stay
work every
safe.
day. Thank you,
We're
G.
working
Thank
too,
you.
but our work is completely different, man. We're just married to this computer and this phone, but you're
I
still
hear
there
you.
with people.
At least the virus you get through the computer damages the computer, not human life. So
That's true, man. That's true. Thank you, man.
thank you, G.
Um,